And let's bring the meeting to order. And where's the camera at so we can, James?
Straightforward.
Okay, I'll go forward, straightforward. So we'd like to.
Now, everyone else needs to mute. If we have a.
Okay, we have 4 new members or potential members that are here, so I'd like to introduce them. Ron, you want to say hi? Okay, and let's see. Julie is here, she left, and there's new member. Teresa, are you new member? Okay, Teresa. And let's see, what's the other 2? We had 2 more. Yes.
I'm James.
James. And we have 1 more. Well, I think Julie left. There's one more.
And I am signing up for membership for myself and my husband's college.
Okay. And just about 2 minutes just to tell what the Kitsap Computing Seniors does. You know, we do everything from, you know, I know this is a computer and I don't know anything about it. So how do I turn it on? How do I use it? We do that. And then we say, well, I got it all turned on and I can do a little bit with it, but how do I do this, this, and this, and this? And then we got intermediate, which Larry does that. Mary Ann does the beginner. And then I think in our community right now, we have a lot of people that are in need to restart their life, you know, where they don't have a computer or don't have a laptop. And we're going to try to help them out by getting a computer. So we take over and we have computers are donated to us. We refurbish them. James is not here right now, but anyway, we refurbish them, and then we have I'm going to call it a disbursement where we go back up and review that the person really needs one, and then we'll get it to them, and then so they can use it to go to college or restart life or learn how to use a computer so they can maybe get a different job. And we want to go back up, and first thing we want to make sure that we know that you don't have to be over 50 or over 60 or over 70 to join the Kitsap Computing Seniors. You can join at whatever age you want. So I gave a membership to Liz and Michelle to have them come and join us. And one of the things we're going to try to do with the trustees, we're going to try to get a speaker for an entire year. And we're going to try to get that out to everybody so that you can mark your calendar. And I'm absolutely not going to miss November, and I'm not going to miss February, because I really want to hear about the police department. I want to hear about what the hospital is doing up here. And it will give you an opportunity not to miss something. And you don't have to become you don't have to be a member to come in here and listen to our presentations, because our presentations are open to the public, because we want to become a friendly place. We have cookies, coffee, water, you know, because we want to make this it's supposed to be a friendly place. Organizations should be friendly, enjoying themselves. And all we have to do is get one of these trustees. They're going to take over in 24, and I'll be president this following year. But if I can't find any of them, James will be the president starting in June. So one way or the other. But anyway, we're going to first start out, and we've announced our new members and our visitors. And I'm going to introduce Michelle and Liz when it comes time for the presentation. And we're working on a bunch of different things at at our trustee members, and we're trying to get that all ready to go. So first thing let's have a pledge of allegiance to the flag. Please stand up.
Where's the flag?
Okay, I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Okay. Carol, would you give us a? Yes, go ahead.
Someone gave BJ $20, but we're not sure who it was. Can someone tell me who it was that gave BJ $20?
Roger Miller.
Roger Miller. Okay.
Okay.
Thank you, Roger.
Okay, we're going to have Carol give us a little presentation on our finances. We're going to be discussing at the trustee board about getting our ability to get CDs instead of putting them in a 1/10 of a percent. And all account at the bank. Go ahead.
Should I come up here?
Yeah. You could walk around.
Okay, as of April 30th,
we had in our savings account $12,050.55. And in our checking account, we had a total of $2,666.60. And that's because we had deposits of $164.82. But we had checks written of $1,298.86 to reimburse New Horizons and Our Savior's Lutheran Church. I wrote them a check for $400, which paid for March, April, May, and June. We're going to pay them at quarterly. That's it.
Why don't you give a little bit about the great gift? Why don't you talk a little about the great gift? You got the numbers on our great gift. How much we got for
I
the
don't have
great
it
gift?
in front of me, but I thought Lorraine had that. We got, we have some very generous members who donated, and we got $1,550 plus 30, $1,580 at the great gift.
And I think we should give a hand for those people that donate. Okay, we've got that. Got our, I'm going to introduce the guest speakers we have. Let me go sheet out here so I know all the things. We have Michelle McMillan and Liz Davis. They're from the Kitsap Public Health Department, and they're going to bring us up to date on what COVID guidance is, vaccine, general infection, preventive practices, other local health, current events. And so we want to go back up and learn as much as we can. And hopefully you will be able to support us and take out a membership with us. Go ahead.
Hi, everybody. I'm Liz, and this is Michelle. So we have a couple of handouts. We were going to talk today. Michelle was going to go over some different COVID resources. We were also going to talk about the end of the public health emergency, which I'm sure a lot of folks have heard about in the news and what that might mean for us moving forward. And then I was also going to talk about some COVID, the updates with the COVID vaccine, and then probably talk about a couple of other things like masks. We've got some COVID tests here, so y'all can actually take those as a parting gift if you so choose. So with that, I'm just going to go ahead and hand out a couple of things to everybody. Do you want me to do it? Okay, you go.
I was thinking we were going to be speaking over on this side, so there we go, right in the middle.
Right middle. Okay. All right, so I can go ahead and get started. Can everyone hear me okay? Volume wise, good, okay. All right, so my name is Michelle McMillan. I am currently the COVID-19 program coordinator at the Kitsap Public Health District, or KPHD. I started at KPHD in November 2020 as a disease intervention specialist. So I was focusing on COVID-19 case and contact investigation at that time. As you guys all know, the pandemic has changed quite significantly throughout its course. And yes,
I can't hear you back here.
okay. I'll try to talk louder. Is this any better? No? Okay. So as the pandemic has progressed and, you know, the sheer volume of cases just continued to increase, we decided to really focus our efforts on outbreak mitigation and investigations, and then focusing specifically on high-risk congregate settings. So places like long-term care facilities or schools, childcare, or other congregate settings like transitional housing or correctional facilities. So that is what we are continuing to do now. The first handout I have, which I hope everyone has a copy of, are these symptom decision trees that the Washington State Department of Health put out. There's a front side and a back side. The front gives you guidance for what to do if you have COVID symptoms. So they list all the main COVID symptoms up here in this blue box. And really the primary recommendation if you have symptoms is to stay home and get tested. And usually it's a good idea to isolate or stay home for 5 days from your symptom onset date. So your symptom onset date is day 0, and then starting day 6, you can leave isolation as long as you haven't had a fever within the past 24 hours and your symptoms are improving. They have, let's see, you can leave isolation, starting day 6, but it is recommended that you continue to wear a mask when you're in public or around other people for day 10. The backside symptom tree, decision tree is what to do if you have been exposed to COVID-19. And really, they want to know if you have any symptoms. So if you are experiencing symptoms, you should stay home and get tested. If you are not experiencing any symptoms, but someone tells you that they had COVID-19 and you were exposed to them, it's recommended that you get tested 3 to 5 days after that exposure. And it's also recommended to wear a mask for 10 days after that exposure. But you can look at that in a little bit more detail later and let me know if you have any questions. Then the second handout here is what to expect when the COVID-19 emergency ends. So many of you have probably already heard that the federal COVID-19 public health emergency is coming to an end on May 11th. So that's this Thursday. Really what the emergency declaration did was relax some government rules and free up funding to allow agencies to respond to the pandemic more quickly. In terms of changes to expect, so after the emergency ends, COVID-19 vaccines, self-tests, and treatments will still be available. However, there may be a cost associated with them. It depends on your healthcare coverage and the insurance plan. And then in Washington state, the state will end its free Say Yes COVID test program. I don't know if any of you guys had used that program, but the state was sending free over-the-counter tests to each household each month. But that will come to an end on May 11th, as will the WA Notify reporting tool, which allowed people to report their test results using their phone, and then it would also notify anyone they had been in close contact with while contagious. But unfortunately, that will also be ending, and certain data dashboards that are maintained by the state will no longer be available, as there will be different kind of reporting requirements and definitions with the end of the public health emergency.
I have one question.
Yes.
What is the expected shelf life of these serums that we've accumulated?
Do you mean the testing kits?
Vaccines.
I mean, what's happening with all that?
I will talk about that in just a minute.
You think?
Okay, you bet.
She's our vaccine expert. But other than that, just a couple of other changes. If you are a basic food or SNAP recipient, you may receive less food assistance. And then if you're covered by Apple Health, you'll just have to verify your eligibility each year. Even though the emergency is ending, COVID is still present in our community. So we strongly recommend that everyone stays up to date on their vaccinations, take steps to prevent getting and spreading viruses, such as washing your hands, making sure you cover your mouth when you sneeze or cough, masking in crowded places, and then staying home if you are sick and reaching out to your healthcare provider if you are at high risk for severe COVID or if your symptoms are severe. Any questions before I continue?
I have a couple of questions for you. How many cases have we had that required hospitalization in the last 3 months? Yes, that one.
Oh, I'm not sure I'm gonna be able to, I'm sorry, I don't know that off the top of my head.
Why don't you let me know? I'll give you my telephone, and I'll let the rest of the membership know.
Okay.
And then that's one of the things I would like to know. And then I'd like to know is what effectiveness, because there have been people that have got shot 1, shot 2, shot 3, and still got it. I want to find out, have they done any studies that talk about the effectiveness of COVID vaccines? Taking them as take 1, take 2, take 3, it's 80% effective or 70%, like the vaccine, the flu vaccine talks about is, the flu vaccine is 40% effective. So, you take it, it might work in 40% of the time, and the other 60% it doesn't work. And I wondered, have they done any statistics, you know, that look at, and I don't know if that's your question or your question.
That's me.
Okay, well, then, well, you can answer that for me, and I'll be very interested in hearing.
So I cannot answer with specific numbers. What I will say is that, you know, there are loads of COVID vaccine products at this current point. And recently the government, I'm sure, y'all heard that the monovalent vaccines, the original Prime series that folks got, where if you got the Pfizer vaccine, you know, you got 2 doses. If you got the Moderna vaccine, you got 2 doses. So those are no longer in use anymore.
Oh.
So they're no longer in use because they ran out? or
No, not because they ran out.
because
So-
they've been effective or what?
Well, so those vaccines, they were called monovalent. So basically they were created for the original COVID vaccine, or excuse me, the original COVID virus. And so now the product that's being used is called a bivalent vaccine. So it was made during the time of the Omicron and the Delta variant. So it's a variant specific vaccine. So there aren't currently effectiveness numbers, like since it's been out to the general public that I can tell you about at this point. The original series of vaccines, I believe that they were 85 to 90% effective with the Pfizer, but the word effective means different things, right? So I think you're asking about like breakthrough infection and things of that
I'm just
nature.
saying, ignorance, as I always tell myself, ignorance is curable.
Yeah,
I'd like to cure my ignorance about it.
So I think that the important thing to consider with vaccines is that no vaccine is 100% effective. Not a single one that is out on the market. What vaccines do is they can prevent you from acquiring an illness or an infection, or 2, they can make that illness or infection less virulent or intense, so that if you do get that illness, you will recover, maybe have a mild illness, and then that's it, as opposed to if you did not get the vaccine, you're at risk for severe illness. So the bivalent vaccines that are available right now and currently being used are holding up really well. I will also say that there are talks of a new vaccine coming out for the fall, but I haven't heard any details about that at this point. Thank you for your question. Sir, what was the question that you had about vaccines?
Just, I want to, I guess it's the shelf life from when these are produced until they're used. How long are they useful? You know, if you stockpiling them again, and they're going to be distributed, and you know, some kind of reason. I'm sorry, I'm not talking conspiracy, but as I see it, they get a large amount of money coming out of the taxpayers that fund this. Okay, then now we've got to distribute it. It's kind of the carrot.
Yeah, so Michelle kind of talked about the end of the public health emergency and how what the end of that means is that a lot of resources and the way that we receive things like vaccines is probably going to be a little different here in the future. Currently, right now, as you said, the federal government did purchase COVID vaccines from the different manufacturers. And currently the federal government is still distributing them. So they are available for free, meaning that providers like your primary care provider or the Walgreens pharmacy, they're not purchasing the COVID vaccines. That is going to change here moving forward, not associated with the end of the public health emergency, but associated with the commercialization of the vaccines, meaning that providers and pharmacies are going to have to purchase them directly from the manufacturer, whereas the federal government was purchasing them before and then distributing them. So that we don't know exactly when that is going to happen, but as of right now, we're still utilizing the federal reserves of vaccine. And that's the vaccine that the health district is using. So we also administer COVID vaccines at our Norm Dix government building on Wednesday afternoons from 12 to 3. So folks can walk in and get a COVID vaccine, or you can also schedule an appointment on our website. But they are largely available at either your primary care provider or most pharmacies like Walgreens, Rite Aid, CVS.
I've got another question.
Of
for you.
course.
I would like to ask you about, is there gonna be any change in the flu? You know, vaccine and flu variants that are coming up this year, obviously, you can't make a vaccine 2 days before you're gonna use it, so you have to look
Yeah.
at what kind of, is there gonna be more virulent, less virulent?
Mhm.
Or is it gonna be about the same and is there only one company that makes the vaccine, or is there multiple companies?
So couple of questions in that question. There are multiple companies that make the flu vaccine. And so what happens is every year, to your point, the flu vaccine needs to be manufactured before people need to receive it, right? So basically what these pharmaceutical companies do, and the teams of scientists that work with them, is they try and decide based off of the best information that they have, using like CDC statistical analysis and things of this nature, which variants of the flu are going to be most prevalent in any given season. And then they make the flu vaccine based on that information. So in some ways, it's a little bit of a crapshoot with the flu vaccine, because you're just not sure until it actually happens which one is going to be the most prevalent. But what I can say is that even if the flu vaccine is manufactured and maybe the dominant strain that's out in the community is not the main component of the flu vaccine, getting the flu vaccine will still help protect you from getting very sick with the flu. So it's still highly recommended that you do get the flu vaccine seasonal.
Or another question. I
Yes.
find it very interesting. I have another question.
Yeah.
Is there, there's 5 companies that build this flu vaccine. Is one better than the others? You guys must keep statistics, and you must say the XYZ company is a 60% effectiveness, and the ABC company is only 40% effective.
No, so I'll have to do a little bit of research into that. I don't know the specifics on the different companies. I don't think that they manufacture different, I don't think that they manufacture flu vaccines with different strains. I think that what is chosen as the strain is what all of the companies manufacture. At the health district, the vaccines that we order come through the adult vaccine program or the vaccine for children program. And so that's a program that is also a government resource, so that we're able to receive the vaccines for free and give them out to folks that are or underinsured. And there are a couple different kinds of vaccines. There's like the high dose vaccine that is recommended for folks that are 65 or older, which I'm sure a lot of you have heard about. And then there are the quote unquote regular flu vaccines, and there are different presentations of that. There are nasal flu vaccines, there are injectable flu vaccines. That was not a direct answer to your question, because
Well,
I don't know it.
That's why I'm gonna give you my telephone number.
Yeah.
And then you can go back in and you can, like I said, ignorant is curable.
Certainly,
No,
happy to research and get
Research
it
and then
here.
let me know. I'll let the membership know.
Yes. Any other questions? Go ahead,
Okay, so I'm sorry, your name again?
Michelle.
Michelle. That's what I thought, but I wanted to make sure. So as far as these test kits, now I noticed on a lot of them, they have expiration dates. Okay, so how flexible are we, on going past that expiration date? And, scientifically, is there, a safe window, to still be using those? And secondly, if you've gotten the first set of the COVID vaccinations, such as the Moderna, the series, is the medical system going to be like your primary? If you're at a high risk group, are they going to be suggesting or maybe making a recommendation to those folks in their annual exam? That now that we have different variants, the spy COVID vaccination.
I can take that. So So I'll answer the test kit question first. So the test kits that we have here are the iHealth test kits. There are multiple different brands that I think were given out over the course of the couple years of the pandemic. So what I'm going to talk about is specific to this, but I will also say that in general, and with this test as well, you know how there's a control line on the test? So essentially, if you're using a test kit and the control line pops up, that means that the reagent is still working. So you can still use that test. And so that is true with this, and that is also true with the other COVID-19 tests that are out on the market, to my knowledge. Another thing is the expiration date. If it's within 15 months, it's still good to go. But then, like personally, when I'm at home taking a COVID test, I just look for the control line, which I have some handouts up here. If folks want to take some of these test kits, you're welcome to. But it has this handout has a really great little diagram on it that shows you the test and where the control line is. It's marked with a little letter C on it. And so that's the line that would come up whenever you're taking the test. Like if it's negative, if it's positive, the C line is going to come up, and that's the most important
Can
thing.
you open one of the test things and show us?
No, I don't think it's necessary. But so.
I've never seen it, so I don't know.
Oh, okay. So, again, there are various different kinds of COVID tests, but essentially what they look like is it's a little card and it comes with a reagent. And so the reagent is the really important part that basically it's showing you that the test will react to whatever thing that you're testing for, right? So if that little control line on the test doesn't come up, that means that either the reagent is bad or the test kit is bad. So you should not use that, and you should try with another test kit.
It's a very, very simple.
Yeah. I think that they did a really good job with the test kits. I will say that as the pandemic wore on and the test kits were coming with things way more separated, it was a lot harder if you don't have the fine motor like dexterity to put the reagent stuff in the tiny little bottle. And but yeah, the test kits have been very, very effective. And we at the health district, we still have a bunch that we are currently giving out to community organizations and EMS and fire. And if you need any test kits, we do have some that are out available to the public on a table in the third floor kind of elevator vestibule at the health district. And forgive me, you had a second part of your question. You were asking about your provider and talking about the new vaccine, correct? Yes, so your provider absolutely should be talking to you about the new bivalent booster. And if they are not, you should talk to them about it. And I will also say that not all primary care providers are currently administering the COVID vaccine, because when the COVID vaccine rollout in the United States happened, the way that it was set up is providers had to enroll to be able to receive the vaccine and administer it to patients. And so not all providers enrolled in this program. However, most local pharmacies are administering the COVID vaccine, like your pharmacy in your Safeway supermarket or Walgreens. And if your primary care provider is not administering it, you should definitely encourage them to. And then also, like I was saying before, you can swing by the health district on Wednesday afternoons because we are administering those vaccines to the public. Yes, you're welcome.
So, this might be a dumb question, but.
No dumb question.
Original vaccines have the dead COVID virus in them, correct?
No. So mRNA, the mRNA vaccines, of which the Pfizer and Moderna are mRNA vaccines, that is a different technology. And so what the way that they were created is it uses RNA sequencing of the virus to basically create the immune response. So it's not a component of an old dead virus.
So those vaccines are called live vaccines, of which the mRNA vaccines are not.
So what are the new generation going to be?
mRNA vaccines. The Pfizer and the Moderna products are mRNA vaccines.
So the one that you talked about for the fall.
All speculate, I have no idea, but I don't see Pfizer or Moderna changing the kind of vaccine that they make. There are 2 other vaccine products that are approved for use in the US. And those are the Johnson & Johnson vaccine, the J&J vaccine, and then also Novavax. And those are also not live viruses. But they do use technology similar to what you're talking about, which is like a piece of the old virus, but it's not alive. It's not going to cause you. None of these vaccines will cause people to get the COVID vaccine, or excuse me, the COVID virus.
So why there are any number of us who are saying we're not taking this anymore?
Not taking the vaccine anymore?
Not taking 3 and 4, you know, probably got 1 and 2, but we're not going to take 3 and 4.
Oh, boy.
Are you, sorry, is that a question? Are you asking why people are feeling that way? You know, honestly, I think people are burnt out. I think that there have been so many iterations and changes and recommendations to the vaccine and COVID recommendations that I think people are a little tired, you know, from the past couple of years. I will say that I think it is still very important to stay up to date on the vaccines, just because COVID, like Michelle said, it's not gone, right? Just because the public health emergency has ended does not mean that COVID is still not making people very sick, if not, you know, killing them across the country and in our community.
Is that because they have secondary conditions having to do with the lungs? Or is that just because of age, that we're older, or?
Yeah, so certainly comorbidities put you at a much higher risk of having severe illness with COVID-19. That's why it's very important for you to stay up to date on your vaccines, and then also take some of the infection prevention precautions that Michelle was talking about. And then the same is true as you get older. Your immune system just, you know, it's not what it used to be. And so it's important for you to just, you know, remain vigilant and keep yourself protected and safe. Yes.
Are there different rules and regulations for people on Medicare, different than younger people?
When you say recommendations, do you mean to receive the vaccine?
For availability of shots and everything else?
Yeah, so Medicare and Medicaid will still, they are going to cover the vaccines, and actually most private health insurers will cover the vaccines as well. The federal government is currently figuring out how they're going to provide the vaccine for folks that maybe are or underinsured and don't have the ability to pay. I think that what that'll look like is a more robust adult vaccine program, which I had kind of mentioned earlier in the talk. And that is a federal and state program that provides routine immunizations to folks that are or underinsured, so they don't have the ability to pay.
Do we have any more questions?
Do you have a handout or step-by-step protocol for those people that somebody says, well, I have COVID and you've been with them recently? What precautions do you have for those people?
Yeah, so I think yes, I think it should be this one.
Right.
Yeah, there's the decision. Did I not give you one? I apologize. I got it.
Back of this sheet.
Here you go. I must have, my fault. You're welcome. Any questions?
Natural immunity? What was her question?
Teresa's question?
The question up in front, what was her question?
Her question was about, is there step-by-step recommendations on what to do if someone tells you that they have had COVID or you've been in close contact with someone with COVID? And that information is on that 2-sided sheet the COVID decision tree.
So what is the health department's viewpoint on natural immunity for those of us who have had COVID?
So immunity, when you have an illness, immunity is a thing. However, it does not last forever. And certainly the virus kind that you got is going to be different more than likely in the future if you do get COVID again. So that is why it is very important, like I said, to either stay up to date on your vaccines, which I would highly recommend, or take other steps to keep yourself protected, such as wearing, such as Michelle had mentioned, like wearing a mask in enclosed tight places, making sure that you're washing your hands, staying away from people that are sick, staying home when you're sick. When you do get COVID, the current recommendation with the immunizations is that you could choose to wait 3 months to get your booster shot of the COVID vaccine, because you are correct that after you do have an illness, your immune system is a little bit more robust when it comes to identifying and fighting that virus. However, that is very short-lived. So I don't want folks to think that just because they had COVID once in the past that they're going to be protected, because that's not the case. Yes.
I'm an old pediatrician.
Yes.
I was around, 80 years ago.
Yeah.
And well, not quite. Anyway, we saw lots of illnesses that could be prevented, like polio,
Yes.
like measles, like mumps, whooping cough, and herpes. All these diseases we don't see anymore, but we should. But my concern is we see misinformation about immunizations. So people are afraid of the vaccine. They worry it's going to give them something. And so we start to see things that we shouldn't see again.
Yep.
But, we're starting to see measles, starting to see mumps, and white people, it's misinformation that's prevalent out there.
Yeah.
And it really is tough. And on the kids that are coming up to not be immunized. I've got some real close friends who have new babies, and they say, I'm not going to get them immunized, but they've never seen a kid with whooping cough, with polio, or measles.
Yeah.
It's just.
Yeah. Yes, you are absolutely correct. And so the most recent information that we have from the CDC is showing some very concerning trends about immunization uptake, especially with children, like you were just talking about, Word. So at the health district, what we are trying to do is work especially with schools, work with pediatricians, work with community organizations to figure out how we can connect with folks in a way that is meaningful for them, to talk about some of the misinformation that is out there related to immunizations. And, the reason that we don't see these illnesses around anymore is because vaccines work, Yeah. So, and I think unfortunately, the pandemic, for whatever reason, made immunizations like this political thing. And so it's going to take a lot of time and energy to undo that and reach those parents of those kiddos, and do some education with them. I mean, ultimately people have to make the choice that is right for them. However, we have these tools available to us to keep ourselves and our families safe. And that is our main goal at the health district, is to provide that information for folks, encourage them to make the best decision for them and their families, but then also provide the information in a way that hopefully it seals the deal,
They've got to be educated somehow.
Yeah.
And the kids are gonna pay the price.
Absolutely. Yep, absolutely. And that's the really challenging part, right? Is that, you know, a lot of these things are preventable or, you know, like I said before, no vaccine is 100% preventative, but it can prevent kiddos from getting severely ill and having, you know, ongoing issues that will probably affect them for the rest of their
And I
lives.
think like muscle, measles, mumps, polio, those things were, if they weren't 100% effective, they were 0.999.
Yes.
You know, they were not,
Yes.
you know, I don't know, you would know more about it, but I would say they were darn close to 100% effective.
Yeah, and, you know, the COVID, mutates,
Yes.
and so you can't just say this is one shot, but it's got to take, into account that the thing is gonna mutate, and there's gonna be a variant there that's gonna continue to give us trouble.
Yeah. And to piggyback off of that, I think what will happen in the future is that COVID vaccines will, and this is me looking into my crystal ball, this is not, you know, official from anybody, but what I see happening is the COVID vaccines probably taking a similar form to like the seasonal flu vaccine.
Sure.
So once, you know, hopefully that process will start sooner rather than later. So it's just like getting your flu vaccine, and gosh, wouldn't it be amazing if they did a COVID flu hybrid vaccine? So you could just get one shot.
Any other questions?
Any other questions?
Well, we gotta get a big hand round the quad. And, the questions, you know, if you didn't have, I'm gonna give my telephone number.
Yeah, and I have business cards
And I'll let
too.
them know, and I'll put out the newsletter, I'll let them know what they came as a response. Because I think it's important for us to learn, you know, learning is an important part of it.
Absolutely, yeah.
And
And I also do have business cards if anyone wants one and wants to like communicate with me separately via email or phone, happy to answer any questions, or, you know, just have a conversation about immunizations or COVID-19. And then we do have some goodies up here. You're welcome to take these test kits if you want. This is that sheet that I was telling y'all about how to recognize if your test is still good. We've also got some hand sanitizer, a couple different kinds of masks. So N95 masks, these are the real good ones, right? Like these are the ones that they have the nurses and that, wow, I'm like right up in the camera. We can see your pores. But these are the really good ones that they have health workers in the hospital that are taking care of COVID patients wear. So this is a highly effective mask.
What do you buy?
So you can buy these online. You could go to Amazon. They are prolific. They're all over Amazon. But you're also welcome to just take a couple of these too. And they have all different kinds. What I will say is with the N95 mask, to make it, so it's called N95 because it filters out 95% of particulates. But to get that 95%, you have to have what's called a fit test done. Which is not really something that the public typically does, but it's something that healthcare workers have to go through every year to get fitted for the particular mask brand that works for them. However, this mask will provide greater protection than a surgical mask, which are the masks that are kind of like everywhere.
We got the rest of the membership here. Would any people be interested in getting a presentation about Narcan and how, you know,
Oh, yeah.
how about, you know, people that are overdosing in our community, how populous it is, what it is, how it's used. Would anybody be interested in that? We can invite the health district to come and talk about that. If there is an interest, we should only do things that have interest to our group. For any interest in it?
Yeah.
Okay, well, what we'll do is, why don't you got my telephone number, why don't you have the Narcan, you know, person that deals with that, you know, and we'd like to go help give a good presentation about how prevalent overdoses are in our community.
Yeah.
You know, who disperses Narcan, what do you see somebody that's having an overdose, what do? You know, how you, this, we're here to learn.
Yeah, absolutely.
But anyway, thank you very much.
Thank you.
Thank you very much, young ladies. We appreciate you coming here and thank you very much. Give me a hand.
And we'll kind of hang out for a few minutes, welcome to have chats or answer any questions that maybe folks didn't want to ask in front of the group.
And we'll have about a 5-minute break and you can ask the young ladies any questions. you
Can
have.
I ask some questions first before we break up?
Yeah.
Not from you. Mary Ann here teaches a very basic computer classes and part of it's in person, part of it's on Zoom. I do the more detailed computer classes called open forum classes. And right now I'm doing all Zoom. I'm wondering how many people, first of all, know how to use Zoom. Raise your hand if you know how to use Zoom.
Barely.
Okay. And second, if I go back to teaching in-person classes, in a month or two, everybody comfortable with having in-person classes.
Yeah.
Okay, and I'm trying to decide if I'm gonna go to the Silverway Library or come here and work something out, but I just wanted to find out, answer